Hi everyone, my name is Jackie and I'm here to tell my story. So since I'm a junior now, 2 years ago when I was a freshman, I was hanging out with my friends in Coronado, the dorm, and it was late at night. My friend was walking me back to my car, which I parked at Tyndall Street garage, and it wasn't that far of a walk, but she just wanted to make sure that I got home safe. We were walking and talking, and all of a sudden, I'm just out of breath. I'm huffing and puffing, and I was so confused what was going on. I thought that maybe my asthma was acting up. I was so unsure what was going on. This has never happened to me before, and so I just thought, we're the end of fall semester. We're about to go into winter break, and so I just thought I would get it checked out when I go back home to San Diego. Before winter break, I also had dinner with some of my friends. Up to this point, I was eating and drinking, everything was fine. Nothing seemed out of the ordinary. I was trying to drink my soda, and I would try to take a gulp, and I couldn't swallow. I just choked on it. It came back up. I thought this was very strange. This has never happened to me before, but I just thought this was another concern that I could bring up to my doctors back at home. Fast forward to winter break, I'm driving to urgent care, and at the time I was 17 years old. So I had to call my parents to get special approval to be seen by an urgent care doctor. And once I got that squared away, I saw the doctor. He comes in the room and he asked me what's wrong, what brings me in today. And I said, well, I have some chest pain and I think something's blocking my esophagus. I'm not sure what's going on around my neck area. So he sends me off to get a chest x-ray and a neck x-ray. And he comes back in the room and he has a bunch of papers in his hands, one of them of which is a pink paper, which I, at the time, figured out it was a transfer paper. And he sits me down, he's like, I'm gonna need you to call your parents again, but I'm gonna tell you what's going on before you call them. And I said, okay. At this point, I'm freaking out. I'm thinking that this is not good news. I don't know what's going on. And he sits me down, he's showing me my x-ray, and he's showing me what looks abnormal. And he's like, I think you have blood cancer. I'm sitting there, all of a sudden just start crying, and I didn't know what to do. I thought this was crazy. I didn't think that this could be true. I didn't think that me going to urgent care by myself at the age of 17 was what I was gonna hear from the doctor. So I call my dad, and my dad is talking to the doctor to fill in the gaps and the details. And then my dad tries to calm me down, and he says, it's okay, we'll get a second opinion. Because my parents were working kind of far from home, my uncle, who's from San Diego, he picks me up from urgent care and drives me to Sharp Memorial Hospital in San Diego. And from then on, I saw an emergency room doctor, and he ordered a CT scan for me. And after viewing my CT scan, he thought that maybe it was a germ tumor, maybe it was lymphoma, maybe it was something benign, but we don't know. That I had to contact my primary care doctor and order a biopsy, and then from then on, if I need to be moved forward to a specialist, then the primary care doctor would take care of that for me. I thought to myself that, well, I'm not getting in through my primary care doctor just because she was booked out months on end, and so I didn't really know what to do. So I talked to my cousin, and he had connections at Rady Children's Hospital. So his connection was a cardiothoracic surgeon, and he took a look at my CT scan from Sharp Memorial, and he took a look at it, and he was like, he invited me in for an appointment and said that there's nothing that we could have done. He told me the exact same thing the emergency doctor told me, to go follow up with my primary care doctor and whatever my primary care doctor referred me to. I come home kind of defeated. I leave the hospital. About 30 minutes after I leave the hospital, I receive a call back from the same doctor. And he tells me, okay, come back in, we're gonna admit you. Clearly something's wrong because it's affecting your swallowing, your eating, like something was wrong, so you're coming back in. And I said, okay. So I turn around, I go back to the hospital, and I was admitted to the emergency room, and then I was elevated up to the ICU room. When I was in the ICU room, I was there for 3 days. They didn't do anything to me for the 3 days, but on the 4th day, they decided to do a CT-guided biopsy. I remember waking up from that biopsy in tremendous pain. I remember crying. I remember asking for so many doses of morphine, and I'm not usually the type to ask for pain medication, so I was in so much pain. and that pain lingered on for a few weeks. Ending that week, I was waiting for my pathology results. Following that week, a lady comes into my room, and she moves me from the ICU room into a different room. The first thought of that new room, I saw a couch, I saw a full bathroom, a shower, and I thought to myself, I just started crying right then and there. I thought to myself, this was it. This was the moment I was gonna die. So I started crying to the lady that pushed me into the room. And she went to go grab a nurse, and the nurse explained to me that this was a good thing to be moved from the ICU room down to the hematology oncology floor. And it was because I was stable enough to move, and it doesn't necessarily mean anything was bad. So I should look at it as a good thing. And so that kind of calmed me down. Following that end of the second week, I was waiting for my pathology results. My oncologist comes in my room and sat my parents and I down for a conversation, and they told us the results, and it came back that I have cancer. I was diagnosed with stage 2 primary mediastinal B-cell lymphoma, a rare form of lymphoma. When I heard this, I didn't know what to think. I was crying, I was overwhelmed, stressed, confused. All I was thinking in the back of my head was, when can I go back to school? I was ready to keep the ball rolling. I didn't think coming home from winter break that I was gonna be here and be told that I have cancer. So I kept going back and forth. I didn't know if I wanted to do treatment in Arizona, to continue school in Arizona, or to do treatment at home, to take a break from school. And when I told the rest of my family, one of my cousins told me, they were like, I don't want to see you with a textbook in one hand and a throw bucket in the other hand. So I was like, okay. So I ultimately decided to take a semester off of school, and I did not return back to the University of Arizona for my freshman year for the spring semester. The doctors continued to talk to me about my regimen, and my regimen was very special. It was different than most cancer patients. It was 5 days long for 24 hours infusion. Because the tumor was so big in my chest, they started me off with a PICC line in my right arm, and that lasted for 3 rounds of chemo. And then when they felt more comfortable and my tumor shrunk in my chest, they switched me over to a port. So my regimen was 5 days long, 24 hours infusion, and then when I get discharged the next day, I was instructed to give myself a GCSF shot. And basically the shot just makes your white blood cells go up and count. And so I was instructed by the nurses to give myself the injection just wherever I had fat. So in this case, I used my stomach, and I bunched up the fat, and I injected myself with a shot. Following that, I have 2 weeks off. Within those 2 weeks, once a week, I would go in for blood draws. And for those blood draws, they would check if my counts were looking fine, everything was normal, I was ready for my next round of chemo. So after my first round of chemo, I started brushing my hair. I started losing chunks of my hair. I was so sad to see my hair fall out. So it became to a point where I stopped brushing out my hair, and my hair just became a mess. It was getting tangled everywhere with the hair that was still attached to my head versus the hair that was falling out. And so eventually I stopped brushing my hair and shaved off my hair. And that was really sad for me because I felt like it was the last part of me that made me look normal. I continued my regimen for 6 rounds of chemo. By the end of April, early May, I was done with chemotherapy. I walked out of my room and I rung that golden bell, and my nurses had a sign for me with my name and farewell messages, and it was a great experience for me, and I was just so happy to be done with this challenge of my life and this chapter of my life. And so I hope by sharing my story that I can help advocate for other patients like me. I remember, because my type of lymphoma was a rare form, the doctors offered me a clinical trial, which I repeatedly told them no, I didn't want to do. I didn't feel comfortable. I just wanted to stick to what I knew worked and just stick to that. And so they kept pushing me to join this clinical trial, and I kept on telling them no, I didn't want to do it. And I also expressed to them that I was still unsure about my journey. about doing treatment in Arizona, still doing school. I didn't really know what was going to go on with my future in regards to that. And I just felt like the doctors were not listening to me in regards to hearing my life outside of cancer. I don't see myself as a cancer patient, but rather as a patient who has cancer. And I also don't think that they were very transparent to me about the dosage of my treatment, because every round of chemo that I received, it got higher in dosage, and it made me feel worse and worse and worse, and I didn't understand why until they had told me that. I think the experience of being a patient has really solidified my choice to go down towards medicine, because I understand what it feels like to not be heard as a patient, and I hope by sharing my story I can inspire others. Thank you.